Email todaycb@rte.ie.
We are coming into the peak renewal period for Irish health insurance customers, and there's a raft of insurers raising their premiums. As I'm sure you've heard, there's never been more reason to assess your options really carefully. And to guide us all through it, I'm joined in the studio by Dermot Goode of healthinsuranceireland.ie. You're very welcome,
Morning,
Dermot.
Claire.
Now, people are getting more and more concerned about this because, as you have predicted on the other occasions you've been in with us, the policies are just ticking up and up and up, and there's no end in sight.
Unfortunately not. And the new average, or the new figure now for the average premium is 1,930. I expect by the end of the year that'll probably be close to 2,200. And if we roll on January 2027, it could be close to 2,500. All the insurance companies are increasing their rates now. Now, they're blaming rising claims. And there's also seems to be a definite shift from people moving from the public to the private system in terms of using their cover. But we don't see any end in sight. We actually thought there might have been some respite at the start of this year, because we all saw 2 or 3 increases in 2023 and then in 2024. But this year has pretty much been a carbon copy of previous years.
Well, there are those who say that because of the new consultants contract, there's less private work happening now in public hospitals. So if you're using your private cover, you're going into a private facility, that's going to cost more.
And definitely that is one of the factors as well, because it is increasingly more difficult to get access to a consultant privately in the public system. And that's one of the aspirations of Sláinte Care. We're now seeing that definitely having an impact. But I also think, though, people are much more educated and clued into how to use their private cover. So if I do go into the public system, I really have no choice of consultant, can't choose my accommodation, can't choose my hospital. And for a lot of people, they can't choose when they go in. So, for a lot of people now, they want to have those choices, and they also want to get in quickly for those diagnostics. So we're seeing more and more people go into the private system because that's where they have a choice. That's where they can basically dictate who they see, when they see them, and on what basis they get the treatment.
But
so
for most people,
cover.
if they go into the public system, they will be well looked after, and it's important to say that as well.
Absolutely. And look, right now, it's really a matter of choices. So for people who have any life-threatening conditions, cancer, orthopedics, cardiac, once you get into the public system, the treatment is absolutely top class. But what tends to happen is if I need routine diagnostics, if I have a sports injury or I need to get my hip replacement, we all know, I think there's roughly 700,000 people, depending on which statistic you look at, on waiting lists for that type of treatment. A lot of people, they don't want to wait. And that's why 47% of the population still pay for private health cover. I would suspect if and this is the elephant in the room with Sláinte Care, if you get rid of those waiting lists and people know they can access care in the public system in a reasonable time frame, then you're going to find a lot of people will probably reduce or maybe forgo their private cover. But that's not going to happen anytime soon, I'm afraid.
Right, but that is the ambition, but we might be a bit away from that. Now, you've talked about this many times before as well, but it's often the older members of these schemes, the people who have the higher cost schemes, they're going to see the bigger increases, aren't they?
They are. And right now, I mean, this is a call out to all those members and their families who are still on those plans, the same plans for 10 years or more. They're probably looking at increases of €300 per adult. Like a retired couple now, definitely €600, €700 on some plans. So really, anybody who's paying more than €2,500 per adult, like Claire, there has to be a clear reason why they're doing that. For a lot of people, the reason is inertia, fear, and they auto-renew each year. And I would call out to all their families now, you need to sit down with them and do the review with them and just be with them when they're on the phone to the insurance companies, because they're easily frightened and they're easily put off. And if there's any element of fear or doubt, they will auto-renew on the same plan. They're facing massive increases. We're already getting the inquiries coming through now from older members who still want to keep full cover for the hip replacements and knee replacements and so on, but they're facing massive increases that are, quite frankly, now they're just unaffordable. So they will definitely need the help. And I would say to those people, do the review early. Don't leave it till the end of the year when you can't get through to the insurance companies, but you need to start picking up the phone now.
People who might be older and are on these plans for quite some time. We are 80 years old. We're on the health insurance plan Simply Connect Plus. What company is that with, Dermot?
This is a Leia plan.
Leia plan. The cost, they say, is getting too expensive for them. It's increased by €1,200 this year. What can we do?
Okay, so that plan today, €2,434. It's going to go up to over €2,700 on the 1st of October. Given their age, I would imagine they want to keep full cover for the hips, knees and shoulders. There is another alternative with Leia called Simply Connect. Drop the word plus. and that plan might save them about €200 each. I have to say, though, in terms of, future-proofing cover and keeping the essentials in place, there is another plan I would say to them right now that they need to check with Leah. It's the same price. It is far superior cover. It's called Prosper Advanced. Prosper Advanced is €2,417. They will get much better refunds on their outpatient expenses. They'll get a private room in a private hospital. They'll keep everything that they currently have. So right now, assuming they want to, I suppose, invest similar money and maybe upgrade their cover, they need to check out Prosper Advanced. One other thing I would say to anybody on those plans, if you don't think you need full cover for hips and knee replacements and shoulder replacements, maybe you've had them, or maybe you just don't have those issues, or you don't have cataracts, maybe you're overinsured. And for example, for that person or that couple, they could check out a plan with Leah right now called Connect Choice, €1,668. It's basically the same plan as what they have, but they will be saving right now €800 each. And the only thing they're really giving up, they won't be fully covered for the hips, knees and shoulders. There will be a 20% shortfall. And if I could just say this now, there's a thing that we always talk about, managed risk. So if I could save that person, imagine there was 2 adults in that policy. If they go to that Connect Choice plan, that's €1,600 they'll save this year. Mm-hmm. If in 5 years they need a hip replacement, which will cost €15,000, the shortfall is €3,000. But in that 5-year period, they've saved €8,000 on their premium. So sometimes that managed risk makes perfect sense. And by the way, you could have a couple on a policy where one person needs full cover for the hips, but the other doesn't. So you can also split the cover. So I would say to anybody, maybe who's not too worried about those procedures, you don't need to be on those top plans. And maybe for that person, speak to an advisor. There's loads of advisors around the country who will go down through those questions with you to basically focus on the key essentials, but also to maybe forfeit or reduce certain aspects that just aren't essential
that you
anymore.
Don't need. So Prosper Advanced if you want to keep your full cover, or Connect Choice if you're willing to take the risk, the calculated risk.
Exactly.
On
and it's
your cover.
only, this is another thing, Claire, it's only on 14 procedures. 14
yes.
hip, knee, shoulders and cataracts. Those policies cover about 5,000 procedures. So if people are still worried about, cancer and cardiac and everything, they're all still fine. Mm-hmm. So really people need to engage with the insurance company. And by the way, a general tip for everybody, if you can't afford the premium they quote you, phone your insurance company right now, tell them what you can afford and challenge them.
This is my budget, find me a plan that fits.
That's exactly it.
Now, I have another quick one. Can you please explain what are waiting periods?
Okay, so anybody joining as a brand new member who has no insurance right now, there's no medicals, but you will not have cover for a certain period of time. New members are covered for accidents immediately. Any new conditions are not covered for 6 months. They call it the initial waiting period. If you're joining, we'll say, family planning and you're worried about fertility treatments, maternity, you must have 12 months cover on the policy. And the one that really catches people out is the pre-existing. So if I join today and I already have an existing back problem or other issue, that won't be covered in hospital for 5 years. So I would say to anybody who's thinking about join when you're healthy, because then you don't really have to worry about these waiting periods. There's one other one that catches people out. It's the upgrade rule. And all that means is that actually that previous question, if they upgrade to that plan, that is actually an upgrade in cover because it covers a private room, even though it's slightly cheaper. So all the insurance company will say to them is that if you have an existing condition, we won't give you that private room for that condition for 2 years. But we'll still cover you on the plan you currently have, up to semi-private.
Okay.
But if it's a new condition, you'll be covered straight away. But they're the waiting periods that apply to everybody.
Okay, this next one. What plan should a 90-year-old in reasonably good health be on if she had been on a VHI Plan D and equivalent forever, but is open to moving? It's costing €5,000 a year, €400 a month, and the message ends madness.
It is. And look, once again, when we look at the age of that member, they should only be on that plan, Claire, if they want to be fully covered for a private room at Blackrock Clinic and the Mater Private. That plan today is $5,118 and it's going to go up to about $5,350 in October. Now, there's another plan that VHI have. Let's assume that person is not too worried about the hips, knees and shoulders and cataracts at that age. And hopefully they're not. There's another plan with VHI that they've just launched called PMI 6410. €3,756 and it covers the exact same hospitals to a private room. But I think sometimes as people get older, they don't need to be on that level of cover. So definitely a review of their requirements might be in order. For example, there's one other plan with VHI they might want to check out, which is called Advanced Care 50. day to day, and you still retain an element of cover for BlackRock and Mater Private, €2,700. It's half their premium. So that family with that person needs to sit down and do a review. I think they're way overpaying for their cover based on their age.
And they do too. I think they would agree with you. A family of 4 now, 2 children, and the children are 10 and 8. I cannot afford private health insurance. Are there any alternatives?
Okay, so what I would say straight away, right now, I'd want to know what their budget is. I want to know what plan they're on. But there are great deals in the market right now. And for example, Leia Healthcare, even though I give out about them with all the increases, they have a deal in the market right now for young families. So you pay for the eldest child under 18 and you get the youngest child free on a plan called Essential Connect Health. So right now, for that family, I would be suggesting if they were talking to Leia have just launched a new plan called Access Health, which is about $1,050 per adult. And they can put the 2 adults and the eldest child on that plan and then put the youngest child on the Essential Connect Health, and it's free. But for any family listening now who's totally bamboozled by all the plans, the key starting point is your budget. What can you afford to pay next year? And start with your current provider and just phone them up and tell them that's my budget. And people give out about the number of plans. Don't worry about that. Let them worry about that and let them go through all their plans to see can they find you something.
But what about alternatives? Say if you just want to get a bit of money back perhaps on your GP visits. Can you do that?
You can. Now, what I would say to anybody who doesn't have health insurance and maybe can't afford it, maybe it's just too expensive now, which by the way is happening for a lot of people. There's another range of plans that people don't even know about called health cash plans. I have one of these plans for about 15 years for my family, right? These plans are excellent. They are not private health insurance, but they give you amazing refunds on all your routine, everyday outpatient expenses. Dental, optical, GP, consultants, physio, everything. The company, the leading provider in Ireland on that is HSF Health Plan. And for a single adult, they have a great plan called One Scheme 3. That plan is about $560 for the year. That plan, by the way, Claire, has €450 back on dental and optical, even though your premium for the year is $560. And for a family, they have a plan called FCA. Now, they have about 15 different plans, but I like that scheme. So I would say to anybody now who's completely priced out of health insurance, just can't afford it, but they've a lot of ongoing outpatient expenses, contact HSF Health Plan, tell them your budget, and you might be very surprised to see exactly what benefits you can claim. And by the way, some of those benefits you can claim immediately on joining.
Right, okay, so they're health cash plans that you need to look into.
They're called health cash plans. They're not a substitute for private health insurance. That's the key thing to point out. So for people who have a lot of ongoing expenses, they're very good. You can buy them standalone or to complement your health insurance. But if you're looking for, I suppose, a cheaper alternative to private health insurance, the cash plans won't give you that.
Dermot, we have to leave it there. The clock is against us. So many questions to get to, but we'll see you again soon, no doubt. Dermot Goode, thank you for coming in from healthinsuranceireland.ie.